Okay, great. Just hi, thanks to all of you who have tuned into my page for this very first update on Facebook Live. I will tell you this is a first here, so it's a bit of an experiment to help me connect to you while I'm back here in Washington, D.C. on issues that I may be called on to vote on in the very near future. Today, we're going to be talking about healthcare, but this is something that I would like to do frequently, so I'd ask you to stay tuned for further updates, other issues, not only on healthcare, but other things. So again, I'm new to Facebook Live, but many of you probably know that you can leave comments right here on the video. So if you have questions related to healthcare that you'd like me to answer, please type them in the comments section, and I'm going to try to get through as many as I can in the next half an hour. And if you can't watch the whole update in real time for any reason, the video will be archived on my Facebook page. So please bear with us as we try to work through these kinks. So, healthcare reform and where we are right now. The American Health Care Act, which is the House's reform bill, has gone through multiple committees on the House side, but a final vote has not been scheduled. You may have just heard the news that the House has postponed the vote that they were anticipating taking later this afternoon or this evening. So things are still in a state of flux over in the House, but if and when the House passes a bill, that's when my Senate colleagues and I will have a chance to weigh in. But I have some concerns, several concerns, and want to share with you today where I am at on healthcare reform. First of all, I remain committed to repealing the Affordable Care Act. In Alaska, we are down to one provider in the individual market. The state has been forced to spend its extremely limited general fund dollars to stabilize that market, even as our premiums are still rising. So you've got rising premiums. We've spent a lot as a state to attempt to stabilize, and we have just one provider on the individual market. Given our state's fiscal situation, we can't expect the state to spend an additional $55 million a year to keep premiums from rising 40%. We've got big problems with the Affordable Care Act, and I'm the first one to acknowledge that. And I have said that our individual market is really a wreck. But having said that, I cannot and will not support a reckless repeal process. Alaska and Alaskans have way too much at stake, and we cannot afford to get this wrong. When I spoke to the state legislature in February, I laid some of my priorities at that time, and I stated very clearly that I do not support repeal of the ACA without a clear replacement. I don't support pulling the rug out from under those who have received coverage, and I do not believe that Planned Parenthood should even be part of this debate and the potential for defunding. We must allow individuals to stay on their parents' plans up to age 26. We must continue to prohibit insurers from discriminating against pre-existing conditions, and there should be no lifetime or annual limits. And I do not want to see the Indian Healthcare Improvement Act, which was attached to the ACA, wrapped up in any repeal. Now, the House bill that is underway now is a replacement, but my view is that this is a flawed replacement, and I think we're seeing some of that as the discussions are going on in the other chamber now. We know that in Alaska we have the highest premiums in the nation, and the House bill simply does not properly take those costs into consideration. The advanceable and refundable tax credits within it do not come close to accounting for the costs of care in Alaska, and they would really be leaving Alaskans behind. The ramp down of Medicaid expansion and the Medicaid reforms do not take Alaska's unique needs or complex system of care into consideration. Medicaid services have benefited our Alaska Native populations. They've benefited individuals that suffer from mental health or addiction, and so many other Alaskans who have really gone without coverage for long periods of time. Some haven't had coverage their whole lives. And finally, I am disappointed to see this already complicated debate further clouded by provisions that target Planned Parenthood, which I believe is an important provider of health services for women in our communities. So I do not want to see us replace one inflexible health care bill with another. I believe, and I firmly believe, that we have to be thoughtful. We have to fully consider the varied geographic, social, and economic conditions of all our states. So as the House has gone through their efforts, I've respected that process. I appreciate the work that's gone into the bill. Congressman Young has been an advocate on behalf of Alaskans over there. But as the bill stands right now in the House, I cannot support it. But that's why there's a process. The Senate will have an opportunity to work on the bill if it comes over from the House. And so you may be asking, okay, well, what am I going to be working on? I'm advocating for a tax credit schedule that better reflects the needs of Alaskans. I want to see support and improvements for Medicaid, and I want to protect the increased services that are offered by Medicaid expansion. I want to increase Alaskans' access to care instead of targeting organizations like Planned Parenthood that do just that, provide that access to care. But to find solutions, I've been working with folks in the state, some of our Alaska legislators, a lot of stakeholders there in the state. But discussions like this with folks from around the state are important because I share the stories that I'm given with my colleagues to educate them on what an outlier Alaska really is in the national debate. So these are difficult issues that we have in front of us, but the fact is we've got a failing law and a broken system. We now have a possible replacement that the House is working through, but again, in my view, it doesn't solve Alaska's problems. Again, the flaws in the ACA have led to skyrocketing premiums, diminishing choices in coverage, and escalating costs for Alaskans. So my commitment is to genuine health care reform that is affordable and accessible, but we need to do it right, and we need to take the time to do it right. So now I'd like to hear questions from you all.
Thank you, Senator. I'm Karina Peterson with Senator Murkowski's office, and I'll be monitoring today's Facebook Live. Throughout the video, please ask questions by commenting right on the video. Senator, first question, why haven't you weighed in about the House ACA replacement bill?
Well, I think the easy, quick answer on that is this has been a moving target. We saw a bill laid down a couple weeks ago, but even when it first came out, it was very clear that in order to gain support, there was going to be a lot of movement in many different areas. For us in Alaska, looking at the tax credits and seeing the incredible discrepancy that Alaskans would be faced with, it was apparent from the get-go that there were flaws with the House bill. And so recognizing that the House has a process that they go through, and in fact this measure has gone, or iterations of this measure have gone through 4 separate committees. Now it's in the Rules Committee, but again, the discussion here in Washington, D.C. as we speak is the consideration of the House bill is on hold right now because they are still trying to work through so much of this legislation. And so my tendency is to not be critical of something that we're not working on here in this body. Allow the House to move through their process and recognize that it really is very much a moving target and still is to where we are right now.
Thank you, Senator. Next question. What is your response to the report from CBO saying that 24 million people will lose their health care if this bill passes? Do you think that is acceptable?
No, I don't think it's acceptable for 24 million people to lose coverage. I have said that the whole purpose behind health care reform should be to ensure that we're doing what we can to reduce health care costs and to increase access. So when you're faced with a reality that a proposal in front of you is not going to increase access, increase coverage, but is actually going to allow for greater exposure, that's a direction that I think takes us backwards. And that's not the direction that we need to go on healthcare and healthcare reform.
Thank you, Senator. And just a reminder for everyone throughout the video, you can ask questions by commenting right on the video.
And Karina, if I can just interject on that, because that CBO score, I think it's important for people to know that understanding the CBO analysis is we don't want to get too hung up on one set of numbers, because they are still awaiting a second review from the CBO in terms of what the actual impact will be. So will it be higher than 24 million? Will it be less? At this point in time, we don't know.
Okay, thank you. Next question. Senator, how do you imagine Medicaid will serve Alaskans if it is pushed back to the states without federal funding?
Well, Medicaid has been an important support for Alaska. It's important across the entire country. But I think we need to recognize the extent to which Medicaid has helped not only our lower income residents, but how it has helped within the Alaska Native community, how it has helped with those who are dealing with mental health issues and substance abuse disorders or addictions. The Medicaid expansion and what we have seen, there's been some additional 30,000 Alaskans who have been able to access services because of Medicaid expansion. I made a statement before the legislature back in February, and I told my fellow legislators that what we have seen with the benefits provided through Medicaid have been significant and important to our state, and I want to work with our legislators to make sure that we're not rolling back that support that we have seen, that benefit that we have seen. Again, for some in this population, this is the first time that they have seen coverage, and for some, perhaps for the first time in their life. And so making sure that they have access is key. And I don't want to pull the rug out from underneath.
Thank you, Senator. Next question. Can you please guarantee that the vote will continue to be postponed until our elected officials have time to read and understand the law?
Well, I can't guarantee anything on the House side. That's a completely separate body, but I understand the viewer's question. I think it is important that we know what we're laying down here, and this is where I have urged caution and a thoughtful, considered process, rather than we need to move something by a date certain and rush something just to say that, well, we kept that promise that we were going to repeal and replace this. We need to do this right. Getting it right is more important than rushing it through a process, and making sure that as lawmakers we all have a chance to read it. Right now, I don't know how many times just in this discussion I've said it's a moving target over there on the House side. I wouldn't want to be sitting in the House and being told that we're going to vote tonight at midnight. That's not right to the lawmakers. It's not right to the American people. It's too important that we get this right. Let's take the time to get this right.
Okay, thank you. Next question. How do you plan on protecting Alaskans with pre-existing conditions?
Well, this is a part of the Affordable Care Act, the ACA, Obamacare, whatever it is you want to call it, that I think everybody came together on in saying we have to make sure that those with pre-existing conditions are not shut out of access to health insurance and to a level of care. There was agreement with that, and there's also very strong agreement that young people under the age of 26 also be allowed to remain on their parents' policies. So as you look at just about every iteration of healthcare reform that is out there. These pieces, these very key pieces, remain in play, and it's important that they not only remain in play, but that they get locked in to law. So my hope is that this is not a battle that we will have to fight, but that there is consensus that when it comes to those with pre-existing conditions, that they be able to gain coverage as they rightly should.
Thank you, Senator. The next question. Senator Murkowski, what can we do to support your position of protecting Planned Parenthood?
Well, I thank you for that. I have long said that Planned Parenthood provides valued and necessary services, not just for women in Alaska, but men and women in Alaska and around the country. And unfortunately, so much of the focus around Planned Parenthood has been on abortion. Recognize that federal dollars are not used by Planned Parenthood for abortions, period. The services that Planned Parenthood is able to provide through the Medicaid dollars that they receive goes towards women's health care, whether it's breast and cervical exams, whether it is STD screening, whether it is access to affordable contraception. And so making sure that we do all that we can to provide for access with services that are available and affordable is something that I'm going to continue to fight for. So this is something that, again, I do not believe that this defunding issue should be part of the whole discussion about health care reform. And I think it has been an unfortunate detractor. There's much discussion about whether or not it is even subject to reconciliation under the Senate rules. We'll cross that bridge when we get to it. But the question is what can people do to help me in this effort? It is simply to continue to weigh in. Weigh in. You don't need to weigh in with me, because I know that support is there, and I appreciate that. But remind other lawmakers that women's access to care, and again, when it comes to services throughout the country for men and women, Planned Parenthood plays a vital role, and just keep weighing in.
Thank you. Next question. As someone who lost insurance coverage this year, thanks to MOTA leaving Alaska, what are you doing to eliminate cross-state restrictions on insurance plans? Why can't I buy the same plan in Anchorage, Alaska as someone in Miami, Florida?
It's a great question. And we talk a lot about, well, we could solve all the problems. You know, Alaska is high cost. There's not as many people. Our market is small. If we could just have access to a bigger pool, we could offset some of the costs, kind of spread the risk, if you will. And many have looked to buying across state lines as this great remedy, this panacea that will make it all better. There's a lot of discussion about the opportunity to advance measures later on, after this reconciliation process is through, that would address just that, the ability to buy across state lines. And I have long been an advocate saying that would help us in Alaska. After more study, I don't want people to believe that this is going to be the end-all and be-all and a way that will help us reduce our costs here. The fact of the matter is we are expensive in Alaska. And the ability to buy in another state where their rates might be lower doesn't necessarily mean that will automatically translate to lower rates for us in Alaska. So know that I'm going to continue to advocate for the ability to purchase across state lines, because I think in many parts of the country that will be helpful. and a rising tide lifts all ships type of an approach. But I don't think that we in Alaska should think that this is going to be the thing that saves us. What we need to do is we need to be able to get more providers to come back to Alaska, to get MOTA back here, to get others back here, so that it's not just the one that we have. Before the ACA was put in place, we had four providers that were available in the state. Now we're down to one, and there's some suggestion that if things get worse, we might not even have the one in certain parts of the state. So making sure that we're doing what we can to provide for a level of stability in the market, this has got to be a priority in the very, very short term. There have been a few things that we have done or that have been done since the first of the year to try to bring about some level of that stability. Secretary Price, the new Secretary of Health and Social Services, has moved forward with some administrative procedures, if you will, that are hopefully going to help settle that down. But our answer is going to be to have some level of market stability so that we have additional competition within the state.
Okay, thank you. Next question. What are you doing about the Cadillac Tax?
Well, the Cadillac Tax is this imposition of a tax on higher cost plans, and it is a tax that, well, we name it it has been dubbed the Cadillac Tax. In practice, it will have significant impact on so many of the plans in the state of Alaska, not because we have exorbitant plans and Cadillac-plated plans to speak. It is because our costs in Alaska are just so much higher. And so when you look to the threshold that any plan over $10,400 is subject to this tax, well, in most of our plans that, say, for instance, in Anchorage, through the municipality of Anchorage, the school districts there, most of our plans would be considered Cadillac. So folks are going to be seeing the potential for significant tax increase. Now, we've been able to put the implementation of the Cadillac tax off from year to year because I think there's general recognition that this is not helpful for us. In the proposal that the House is considering now, again, this moving target, they pushed the Cadillac tax off to 2020. I have signed on to legislation, though, that would eliminate the Cadillac tax altogether. Again, in high-cost states such as Alaska, we get nailed every time on this. And it's not because the plans are so generous. It's just that our costs are so high.
Okay, thank you, Senator. Next question. What are your plans to support mental health?
Well, this is again an area where the Medicaid and Medicaid expansion have been significant to us in the state. We know that we have limited services when it comes to mental health. We know that when it comes to treatment, again, for those with substance abuse disorders, addictions, we're severely limited. But what we have seen through what we're calling different waivers that are available through Medicaid, we have been able to gain access to additional resources to help with mental health treatment and services. So when we have this discussion about why I feel so strongly about not pulling the rug out from under the Medicaid program and the services that have been provided, it's because for the first time we've been able to offer a level of services that hopefully is going to be making a difference. You think about it, it wasn't even a month ago that the governor declared a state of emergency when it came to opioid addiction. Well, how do we deal with this? One of the ways that we're we are better able to address it is what we have seen through some of the waivers through the Medicaid program.
Okay, thank you, Senator. Next question. The ACA and Medicaid expansion has helped strengthen tribal health. How will you continue to advocate for tribal health organizations to provide the best care for their people? The AHCA offers no protections for Alaska Natives and American Indians.
Right. And this has been a concern. We've heard from not only our Alaska Native leaders, but those within our Native tribal health organizations, wanting to make sure that within any health reform, we ensure that the benefits that we saw through the ACA are not eroded. I mentioned earlier the Indian Healthcare Reorganization Act, making sure that stays in place. But again, what we have seen with Medicaid and Medicaid expansion has allowed many Alaska Natives to gain access to a level of care that has been significant, has been important. You mentioned the House bill and the concerns that, at least at present, it doesn't address the cost sharing subsidy aspect. And again, this has been an important component within the ACA that has truly helped our Native health organizations, and so making sure that we do right by the cost sharing subsidy, I think is again going to be very important, and yet another reason why what the House is considering currently is not acceptable.
Okay, thank you, Senator. We have time for one more question.
Okay.
The ACA prevents insurers from charging older people more than 3 times what they charge younger customers. The initial House bill would raise that restriction to 5 times the rate charged to younger people. What is your position on rates charged to older customers?
Well, the question is referring to what they call age banding, and this was an effort to try to address how we get younger, healthier people to sign up for coverage, and so the suggestion that we reduce we deal with the ratios so that it effectively will shift more of the cost from the younger end to the older end. Well, okay, that's going to help your younger population, but it does not help your older population. And think about it. This is a population that is going to have more health considerations, that will be more costly, and perhaps with less earning ability. They may be on fixed income, and so making sure that we get this age banding correct is important. One of the proposals that I have been in discussions with other colleagues about here on the Senate side is how do we ensure that older Americans are not hit with higher costs on top of everything else that they are facing with higher health care costs. You now have higher insurance costs. So making sure that there is an equitable adjustment at the older end has got to be a priority for us. In Alaska, we need to remember the demographics in our state are changing. We are gaining a more older population more rapidly. As I recall, we're number 4 in the nation in terms of the rate of our population and aging. So making sure that in, again, a high-cost state, we are not putting added an undue burden on that older age category is something that we have to get right. What it takes us back to, again, is trying to find a level of balance and equity. And for us as a high-cost state with just barriers to access in so many areas, we're an outlier in so much of the discussion and the argument and the proposals that are being considered right now. And so making sure that there is a level of flexibility for states like Alaska, making sure that we don't take kind of the one-size-fits-all approach that we saw with the ACA that has led to really just a destruction of the individual market. We don't want to take a one-size-fits-all approach that we did 10 years ago and basically repeat another one-size-fits-all that's not going to help us in a state like Alaska. It just doesn't work. So taking the time to get this right is too important.
Thank you, Senator, and thank you for everyone who have tuned in. Before we wrap up, Senator, any last thoughts you'd like to share?
Well, just to thank you. I don't know how it's been on the other end in Alaska, but this has been an easy way to field questions. Hopefully people feel like this was a broad enough discussion that it was worthwhile. But know that we're going to be taking your input. If you think we need to be changing the format or the process, happy to work with you all. So just weigh in, send us your comments, and keep your eye on what's going on here in Washington, D.C. There's a lot of moving pieces, but thank you for your input.